kindly write it in the chat box. There will be an opportunity where we will ask questions and the facilitators will give us answers. And so let us try as much as possible to ensure that we observe this so that all questions will be asked at the end of the presentations. If there, as I said, if there is anything that is urgent you need to bring to our attention, kindly put it in the chat box. You can also write your questions in the chat box as well, and we'll take time to read them out to the facilitators to respond to. During the facilitation, we'll have about 3 to 5 minutes break, and we'll come back and continue. So with these few words, I want to humbly invite the General Secretary, if he's on call, to give us a few remarks. General Secretary, if you're on call, this is time for you to speak. Kindly unmute.
Yes, thank you very much. I'm on call. And thank you for the opportunity. And I also want to thank all who contributed to making this program a success. Thank everybody for making time to join. I think this time around, we have been saying it, but this time we are going to enforce it, that if you don't participate, you don't join, participate, you are not going to be supported to get the CPD credit point. So those of us who have friends who are yet to join, let us reach out to them and let them know that this time around the decision has changed. We are taking care of all those who make time to join. Then we also want to let everyone know that it's not only by for the sake of CPD credit point. Let us also participate effectively and learn something so that the resources put into putting this together will not be waste. And we'll be talking more at the end of the program, the 5-day program. So I'll end here and allow the organizers, the organizers to continue. Thank you very much.
Thank you. Thank you very much, General Secretary. I want to also take this opportunity to acknowledge the presence of all national officers as well as our regional governors. We shall take time to introduce you as the meeting progresses. Thank you so much. So on this note, we'll call on the
organizer,
president.
if you could indulge me, I left out something.
Yes, please go ahead.
Just want to let those who are not members of GHIMA to know that they are to pay some fees. So if you are not a member, you have to let us know later so that we can take you through the process. But if you are a member, everybody is getting this opportunity free of charge. So that is important to send out there. Thank you very much.
Thank you. Thank you very much, General Secretary. And so all non-members should duly take note. On this note, I humbly request the president to unmute and give us his welcome address. Mr. President, kindly unmute. It's your turn now. Thank you.
Hello. Thank you. Thank you very much. OS, can I be heard?
Yes, yes, I can hear you from my side, sir.
All right. Thank you. Thank you very much. I want to officially welcome everybody here on call to this program. This is one of the CPD programs we have planned to undertake in the year. Like the General Secretary stated, it shouldn't be for only CPD, but it's a program for acquisition of knowledge and skills. I will urge everybody to participate and participate well. Not only participate, but make sure you participate well. Make sure you take something home. Make sure you increase your skills and knowledge from whatever you are here to benefit from. It's very, very, very important. Secondly, I heard General Secretary mention it, or organizer mention it, that this time, if you don't participate, you are not going to get a CPD point for your PIN renewal.
Mr. President, I lost your voice a bit. If you can reposition yourself. Am I the only one who is not hearing the president?
No, you are not.
No.
Okay.
All of
Is
us
it
Only one.
hear
I
you.
can also hear.
is it better now?
Okay.
Yes.
I can hear you now. Yeah, thank you.
Yes, very, very well. So we will not continue to do the same thing all the time and expect a good result. Things are changing nationally at the political scene. There is this resetting of the entire nation. And so, yes, it is trickling down. There is a change of authority or governance at the Allied Health Professions Council. Board has changed, registrar has changed. And so please, what we have been doing previously will change. If we go the same way, it will not help us as associations. The president will suffer, national officers will suffer. We won't get the opportunity to speak for anybody. It's just like we are condoning the wrong thing. And it doesn't give respect to the association. President, knowing that your member didn't participate in CPD.
I don't understand.
And so, and then you go begging that person should be given.
Again, Mr. President, if you can hear me, kindly reposition. We've lost your voice.
Yes.
Okay, thank you.
I don't know.
Thank you.
It's like I am periodically I am muted automatically. I don't know. So OS, if you can check that periodically.
President, I'm very sorry. There are a lot of people on call that are not muted. So sorry for that. The mistake is coming from us. So kindly proceed. Sorry.
I want to use this opportunity to ask our members to send a message straight to all members. Come to this platform and make sure you register. Just come and register and participate. It's very, very, very important. There are other issues we'll be addressing. I wouldn't want to use this opportunity or this time to talk to our members about, but I wouldn't have spoken at all. I would have just said, you are all welcome, and then I drop. But for the sake of what we are coming to do, it's very, very important. Let us inform all our members to come right now and register. Thank you very much.
So how do you register?
Important program. I wish you a good stay. I wish you good time. I wish you sweet program.
How do we register?
Thank you.
Yeah,
thank you.
Thank
So
you very
at
much.
this particular stage,
Okay.
we have
Go on.
indicated that everybody should be muted. If you have a question, kindly put it in the chat box and to be addressed. The issue of registration will be addressed. It's part of our agenda for today. So if you have any concern, kindly put it in the chat box, because if everybody wants to be talking, you can imagine the chaos that we'll have in the meeting. So kindly take note of that. Thank you very much, Mr. President, for your warm welcome. And once again, I want to remind all of us that this CPD program is for a period of 5 days. Today is day 1. It is fully sponsored by GHIMA, and it is streaming live on our social media platforms, including YouTube. So let us take note of that. Today, the focus is going to be on GIS application and health data management. So for the next 60 minutes, we will be discussing GIS application in health data management. And to help us do this is none other than our very own, someone who needs no introduction because he has done so much for GHIMA. And most of the times he's always with us anytime we are having GHIMA activities. This is a man who is a public health researcher with very strong background in epidemiology, data analysis, and health system strengthening. He has over 15 years of experience in this work, and currently he is a lecturer at the University of Health and Allied Sciences, most specifically at the Public Health School or School of Public Health. Ladies and gentlemen, kindly help me to welcome our facilitator for today in the person of Livingston Assem, PhD. My boss, you are most welcome, and the floor is yours now. Thank you.
Thank you, thank you, thank you. And I'm glad once again to be part of this session. And basically, for the sake of others who are joining and others haven't met me in person, so I will unmute my camera for people to see my face, those who haven't seen me before. And for some few minutes, then I can put it off. Okay, so my name is Livingston Assem, as you were told. Currently, I am Makat Plus postdoctoral fellow of Cheikh Anta Diop University of Senegal, Dakar, and then University of Health and Allied Science, Ghana. So in Ghana, I am with the Department of Health Policy Planning and Management of the Fred Newton Bingham School of Public Health. So my major is mostly in health policy, planning and health policy assessment. So today, in fact, when I was given the invitation, they told me the meeting would start at 2. I didn't know there would be some introductory sessions before then. So I had already scheduled another meeting at 3 o'clock, but I'll try to see how I'll be able to give my key messages to everybody before I moved on. So today we are looking at geographic information system and then health data mapping. I hope you people can see my screen.
Yes, Doc.
Yes, please.
Yes, please.
We can see clear. Thank you, Doc.
Doc, we can see.
Yeah, so basically, as your colleagues said earlier, I've been with Ghana Health Service for 16 good years before joining the university 5 years ago. So I have a very tall career with health information management. I work in almost all the levels you can count up, from the hospital level to district health directorate to the region. And then I think a little bit of national experience before I bowed out to join academia. So currently, I've been researching into malaria and specifically looking at a global dimension of malaria. Malaria is entering another phase called the elimination phase. And in the elimination phase, one key wing that is important for us to be able to achieve the result of elimination is what we call the malaria surveillance. And as a postdoc fellow, my research is based on looking at how antenatal care population will be a standard for routine malaria surveillance monitoring in the world. This study has gone on in tickles and beats. However, we are operationalizing it in Volta region across all the districts in Volta region to build data for Ghana going into the future. If they will be doing any policy shift, we can use this data as a basis to, sort of ground the reasons for that policy shift. But on that is a brief of what I do. So I'm moving on to today's presentation. And today's presentation, these are a brief outline of what I'll be doing. So, principles of geographic information system. So, why should we know GIS, or why is GIS important at all? As a health information person, or as public health practitioners, or as whatever field we find ourselves, what do we do? Hospital health information, district health information, regional health information, health center, CHIPS. Why is GIS important to us? So spatial aspect of health data provide a lot of insight to chain of outbreak and also to answer a lot of research questions, where questions like, where are the current disease hotspots? As diseases keep coming to our facilities in the districts, regions, or in our locality, there's a need for us to know where the hotspots are coming from. Just like I was telling you earlier, my research is into malaria surveillance, and we are determined to know where these cases are coming from. So instead of formally we go into wholesale intervention targeting everybody, research has shown that most of those interventions yield very little result, or probably might not even bring in any additional effect at all. So the best way to do it nowadays is what we need to retailer our interventions in a way that it will yield the needed results. So you need to know where the current disease hotspots are so that you can properly, appropriately allocate your intervention to give you the desired result. Another question that would also come in mind is, how have the hotspots, what have changed over time? So as we keep putting in all our interventions, for instance, in the space of malaria, we keep throwing in the bed net for ANC, bed net for children under 5. We keep putting the IPTP, SP there. We continue to do case management. We continue to use the RTSS to vaccinate children under the age of 2. And so these are all interventions. So we want to see what has changed after all this intervention has gone on over the years. What has been the change over time, which we need to know. So another question that also comes in mind, how is the access to these health facilities or these health services or these health interventions? So how is it assessed? Is it available? Is it readily available? I mean, if you say every pregnant woman should go for IPTP or SP, is it available at the facilities? So geographic information system will help us to analyze these situations, to be able to know areas that have a strong access gap. We have island communities or riverine communities that are cut off during certain time of the year. What kind of intervention can we put in so that we don't go there to put in certain interventions that will not be useful to these communities? So are there any improvement needed? So sometimes intervention has been going on over the years. What can we do? For instance, the earlier version of ITNs used to kill the mosquito, but a new version has been introduced that called the PBO. It rather repels the mosquito, because there are reasons for these, which the entomologists and the other researchers will be able to appropriately explain. So to know whether there is any improvement or there is any kind of improvement needed, GIS comes handy, has been one of the key tools that has been used in some of these areas to achieve the desired result. So definition and importance of GIS. GIS stands for Geographic Information System. So it is a computer-based system that captures, stores, manages, analyzes, and visualizes spatial data, including maps, satellite imageries, and other geospatial information. GIS allows for the integration and analysis of data from multiple sources, helping to understand patterns, relationship, trends in different geographic data. So GIS, similar to all the information system that we know, it has 5 main components. And then the first component that we need to know is data. Data, as we know, is the foundation of GIS. It includes the spatial data and also the attribute data. So when we talk about spatial data, we'll go into details as we move on. These spatial data include geographical features and their locations. So basically, we are talking about longitude in 2 dimensions. We talk about longitude and latitude. So we also have the attribute, which takes the characteristics of the data and associated spatial data. So we also have another component called the software. The software enables the creation and management, analysis, and visualization of spatial data. There are various softwares that help in doing this. We have ArcGIS, QGIS, EpiInfo, we have R, we have Google Earth. There are a lot of them that, in fact, the list is unending. It's a list that you can count and count depending on where you find yourself and what is useful. But in our world, ArcGIS is more common and more popular. We also have QGIS, which is open source free. And then currently, R has come in through the space of data science and has been a strong tool for data modeling and data wrangling. So these are the software aspect. There are different other softwares that also apply and complement the work of GIS. So the hardware, which talks about the physical component of the computer, and this includes the computer itself, be it in the hardware or the servers, computer devices, and then the processes that we use installing the data. So these include the graphic user unit or graphic user interface, and all the other hardware or physical components or all the auxiliary component that goes with to support the GIS mapping. We also have the people, and these people could come in different forms, from highly skilled professionals who are needed to operate and analyze the GIS data. It could also be a simple learner, like people like you trying to learn some capabilities of GIS and be able to use it to do their day-to-day routines. There are experts that also develop the software applications like the ArcGIS, QGIS. These are high-level experts in the field of GIS that develop these 2 components that we use in addressing most of the health problems. So another one which is not listed here is what we call a set of instructions, or you can call it policy, or you can call it methods, because these are rules, policies that govern how the data is used or data is implemented, or how the whole GIS system is implemented. And it is key because you needed those certain rules to be able to navigate your way in every space. In the space of health that we find ourselves, GIS comes handy, and we need a set of rules that tells the kind of data. For instance, when you pick malaria data in DIMS, for instance, it's collected in certain way. We look at those tested, those tested positive, and then we look at those who come with some clinical signs, but we cannot classify it as malaria. So all this comes in. These are policy instructions that are put in to capture the data in a certain format to make it useful for interpretation. Yeah. So as I told you earlier, GIS address a lot of questions or a lot of issues, and one has to do with location, and different locations, different. So sometimes if you critically look at this country, there are specific hotspots that every year or year on year, anytime you hear cholera outbreak, there's always a connection between those communities and then the spike of those disease outbreaks. We also have quantitative measurements. So you can measure to know whether there is any relationship between the location and whatever you are doing. There are patterns. GIS can help you to check patterns over time. You can monitor to see whether a disease is changing pattern, cases are reducing or cases are increasing, who is affected. We can also monitor trends or what we call the temporal aspects over time. We can also look at surrounding conditions and then the relationship between the health event and those factors. All these also have implications for planning or has implications for future. So whatever arrangement we'll make in the future, geospatially, we can look at some of these data and see how we can refigure or rearrange our environment in a way that it will be able to meet our needs. For instance, if you are planning where to put your next health facility, fine, one of the factors must determine not only because the communities are located or isolated, but you can also look at population, you can also look at a lot of factors, access road, and a lot of factors to help you locate facilities or places that people or a set of communities or a group of communities can easily access it and use. So GIS is important for a lot of reasons and it improves decision making. So you can visualize the data, analyze it, and draw insights from the spatial data. This can help you to do day-to-day decision making. Spatial analysis and modeling, it's also help you to do overlay analysis, proximity analysis, and network analysis. Such analysis help you to know how close we are to the nearest health facility and all that. It also helps in data integration and management. You can combine several data to be able to come out with an information that will be useful to the entire community. So it combines things like satellite images, aerial photograph, GPS data, and other spatial data sets. For instance, if you want to know the malaria foci of Ghana, you can combine the PFPR or malaria prevalence and analyze it with a lot of environmental factors to be able to tell areas that need further or more or a different intervention to be able to yield the desired results. Visualization and communication, maps, charts, and other geographic representation of data. Its costs and time savings. In fact, when you use GIS, it saves you a lot of costs. GIS help in optimizing resources and also reduce costs. It also helps in environmental and social impact assessment, infrastructure development, land use planning, and natural resources management. So GIS has come handy as one tool that has helped us to do this. Okay, so GIS can also do a lot of analysis. Apart from the geographic display, it goes beyond that to give what we call the geospatial analysis. This involves using GIS tools and techniques to analyze and interpret spatial data. It also includes tasks such as overlay analysis, buffering analysis, spatial query, spatial statistics, and then network analysis. It helps in understanding spatial patterns, relationships, trends, and it also supports decision making at various fields. So cartography, you cannot learn GIS without understanding some basic principles of cartography. Cartography is the science and the art of creating maps using GIS, designing and creating visual appealing maps that convey spatial information effectively. It includes elements such as map layout, symbology, scale, projections, and map design principles. So a typical map is what you can see on your screen showing location, and elevation. So maps can also help to do a lot of networking analysis. So with this map, it's trying to explain travel time to a city of at least 2,000 people. And then try to map how many hours it will take you, 1 hour, 1 to 3 hours, and over 10 hours to be able to reach. And it gives all those where the cities are, where there are no cities. Okay, so GIS also show us what we call quality or what trends, where a child mortality is the highest mortality rate per 1,000 live births, or 2000 to, let's say, 2017. So if you look at the indicator there, it shows between the year 2000 and 2017 how child mortality has changed over time. And it shows you how intense it was and how it has improved over time. So GIS could help you do this analysis. GIS also can show patterns, or what we call density patterns. So if you look at a map, it tells you where cases are clustered. And within this cluster, if you have intervention and you want to know where you will be able to place this intervention to give you the highest results or give you the highest outcome, I hope you can tell the dark patches where they are darker. When you tackle it from there, it means you will be able to eliminate the disease in no time. It also shows trend from one continent to another. Which are the areas? Where are the areas? Which areas do we have malaria? How do people move from one area to the other? And you remember during the COVID era, movement of people or migration of people from one location to the other was a big issue, because when people travel, they need to quarantine them, make sure for certain period before they are allowed into the communities as a way of preventing the disease. So GIS or geospatial mapping will be able to map out this to understand the human traffics, where human beings are moving to mostly and where they are coming from. And this will help you put in interventions to address the challenge. So if you go through the story of John Snow, there's another story called the West Nile disease, and similar map was used to address some of these issues. So now let's go through the basic concepts in GIS or spatial data. And spatial data refer to data that has geographic or spatial component, such as location, shape, and then the attribute associated with the geographical feature. Spatial data can be represented as points, lines, and polygons. It can also be stored in various formats, such as vector and then raster. Spatial data is the foundation of GIS, and it can also be collected, created, and analyzed using the GIS tool and GIS techniques. So in GIS, there are two data types that we need to know. We have the vector data type, and then we also have the raster data type. So the vector data represents geographic features such as points, lines, and polygons. It's used to represent discrete and well-defined features such as roads, buildings, land parcels, etc. Raster data also represents geographic features such as grid of cells, where each cell contains a value that represents the attribute or the characteristics. It is used to represent and continuous data such as elevation, temperature, and then precipitation. So vector data such as point represents locations such as city center. Lines, we say they are example of roads, rivers, pipelines. And polygons represent administrative boundaries. We could call it district, sub-district, region, vegetation cover, zones. All these could be represented as a polygon depending on what you are doing. So these are typical examples of each of them. These are points. You can see points. These points could be communities. It could be a lot of other things. Then these are lines, can show river bodies, whatever. And then the green patches you can see there are showing polygons or different shapes or locations. Each raster data, each cell in a raster represents a location and contains a value that represents a specific attribute, such as elevation, temperature, and land cover. Raster data is used for continuous data analysis, modeling, and visualization. So this is how the raster look like. And a darker patch, this is a color ramp. A darker patch could be low elevation, and then lighter patch could show high elevation, maybe a valley, which can be likened to a valley and a hill or something, or a water body. Okay, so we also have what we call layers. In GIS, it's based on this building block we call layers. And layers is what we use in representing the various themes or thematic areas or thematic informations. And these information are stacked together on top of each other to create what we call a map. So to see a map, you need to stack various layers thematically on each other. So layers can include features such as road, buildings, rivers, land parcels. Each represents a separate layer with its own attributes and properties. Layers can be added, removed, and manipulated in GIS software to create a complex spatial analysis and visualizations. Okay, so map also have components, and a map is made up of layers or shapes. Layers also contain what we call the features, and features also contain the points, lines, and polygons. So this is how layers, features, map, layers, features, and then the attributes are joined to give you the various components of a map. So typically, if you can see the map here, this is a map. There are a point feature, there's a line feature, and there are other polygon feature. If you put all together, then you have what you have in the bigger area. So typically, this is how it is layered. Yeah. Composite layer combines everything. There you can talk about the survey control, the soil, the land cover, water, lands, floor, plane, zoning, parcels, and then topographic base. So all these put together will give you a very good looking map like we have. So with zooming in into the attribute data. So to be able to find GIS useful, you need to have more characteristics about your data or your shapefile or the area you are mapping. And these are what we call the attribute data. It refers to non-spatial information associated with a spatial feature, such as attribute data. So an example is the name, population, elevation, land use, or other relevant information stored in a tabular format linked to spatial data using unique identifiers, allowing for analysis, querying of spatial and attribute data together. So a typical example is what you can see, showing the various points, showing the various maps. And when you pick this green line, for example, you can see the attribute of that location. It is showing an object ID, an object name, the object type, the variable name, the HR name, the HP code, or HR parent, and all those information will come as a description or a characteristics of that location highlighted on the map. Okay, so we've already mentioned some of the data sources earlier, but we need to re-emphasize GIS data can be obtained from various sources. So publicly available data such as government agencies. So if you need good map of Ghana, either you contact survey department, another one to map on the population base or different locations of the country, if you contact the survey department of Ghana Statistical Service, that information will be made available to you because they use that information for various surveys across the country to select the areas to be surveyed. For instance, things like demographic and health survey or the DHS, malaria indicator survey, for instance, they use this. We also have the census they do every 10 years. All these depend on that information to be able to make meaning. So these agencies are available to provide that information. So commercial data providers that offer specialized GIS data set for specific industries and applications also exist. So there are quite a number of agencies. SEGIS does a lot of this consultation work for, there's a department in University of Ghana, Geography Department, has this capability in Ghana to provide this support to most organizations within the country. Crowdsourced data collected by individuals or communities such as OpenStreetMap is available, it's free, just need the login details and then you can access all the field collected data using GPS or other data collection devices. You can collect your own data and then use remote sensing data such as satellite images, imagery, area photographs, and LINDA data. All these are available for use. However, to be able to use this data, you must be mindful about its quality and make sure they are of the highest quality. So you must do a lot of quality checks on the data, and this is important because data quality here refers to the accuracy, precision, and completeness. So accuracy refers to how closely the data is to represent real-world feature. You must know the data scale refer to the level of details or resolution of the data. Data relevance refer to how well the data meets the need of a specific geography. So for you to be able to do GIS, there are steps to be taken from the feature data to the map analysis. First, you need to understand your geographic environment, and this, you must know it, recognize the geographic information system, and then you do your map, then you come out with your image. So we've already gone through the various ways through sensors, ground survey, remote sensing, compilations, and then you select classification, simplification, exaggeration, and symbolization of your map. Here you read your map, analyze it, and then come up with your interpretation. So map design process also go through different steps. It start with you consider what the worldwide distribution of a phenomena might look like. Then step 2, you determine the purpose of the map and its intended audience. Step 3, you collect the data appropriate for the map and the purpose. You design and then construct the map. Determine whether users find the map useful and then informative. Okay, so in doing all these, you might need tools to be able to support this. So you need GIS softwares to refer to the application tools used for creating, managing, analyzing. So a popular tool among them is the ArcMap that most of us know. Those who came through UHAS were taught with ArcGIS, but there are which belong to Esri. It's proprietary, it has a license, you need to pay to be able to use it. So it is not a tool. If your organization cannot pay, then probably the easier one would be to use a QGIS, which is an open source. It's available. MapInfo is also available. LPinfo and Google Earth Pro is also available. So these are popular tools that is used in different jurisdictions. This software also provides a wide range of functionalities such as data visualization, spatial analytics, data editing, and also map production. These tools, there are tools also that you can plug in, have specialized plugins that extend the capabilities of GIS survey. So there are some that does spatial analysis. You need to plug them in using other geocoding procedures or remote sensing tools. These tools also enhance the functionality of GIS software and enable users to perform specific tasks or analysis. So basically, using the ArcGIS 10.x, simple, the interface look like this. You click and then it brings you the first screen. So in the first screen, you have the data frame, and then you have this area called the table of content. The top here is the menus, and then you have the other tools for query and zooming. If you look at the zoom in, zoom out, full extent, these tools are very useful ArcGIS tools that could help you navigate your way through the map. And basic mapping toolbar has all these, and you have the zooming tool, the view tool, the select tool, the normal arrow cursor. These are the identity, and this is the pin or the pan. So these tools are there to help you navigate your way. So basically, we could try our hands in this later. I'll make the slides available to you. You could follow this instruction and try to symbolize a simple map using hierarchies, and you see how it works like. So another area that you need to know about the ArcMap is that it has a feature that's the properties tab layer. So when you click on the properties layer, it takes you to this window, and this window has all the tools you need to do your basic symbolizing of a map. And when you check this area, you see if it is categorical data, you can put in unique values from any match symbols. And then you have the quantities, which gives you the opportunity to look at the graduated maps, and all that matter can equally look at all of them. You have the graduated colors, graduated symbol, proportional symbols. These are typical examples you can see in there. It helps you to map your work. Yeah, so when you are mapping, you need to be informed by some literature at the background, and this literature range from different areas. How to scale your work, it depends on what kind of classification approach you want to use. For instance, if we are talking about immunization data you want to map, things like immunization data, there are global targets. 80% is herd immunity. Ghana has a target line of pentatric coverage of 90% or 95%, I don't know, whichever it is. You need to know these things in mind to be able to help you to properly classify your data, so that if you map them, it will be able to communicate well with your audience. So these are some examples. You can do a whole lot of analysis. This portion I told you earlier is called a table of content, and this is called a data view area. You have another tool up here. You can see it in there. It's called the Arc toolbar. It has all the tools that help you to do all your geospatial analysis. So there are several tools there that you can use to do your work. So before you can work, you need the shapefiles, and shapefile database or shapefile file has a set of files. Usually that is why you work from a folder, and all these files are stored together, because if you miss one, your shapefile will not work well. So you need to store them in a common folder, and that is how it works. For instance, there's a folder here called GIS training, and then you have all the shapefiles. Then you can map them like what you can see. So there are various maps. This map is typically called the chloropet map, otherwise known as the graduated maps. So you can use symbols to equally do what is done in these maps. Okay, so I I want to end here. If you have questions, then I can address them and then we can move on. So basically, those are the key things in GI. GIS also have, okay, let me just add this one. We have projections. Map are also in projection. There are different projection settings. We have the cylindrical, cone, and plane. And before you become a mapper, you must understand some geography behind some of these things before you use them. And you must know the type of projections that was used for the shapefile that you are using, so that if you are interpreting it, you can interpret it in context. You don't be explaining it, meanwhile you yourself, you don't. So you must understand some of these things, how it goes before you should be able to use. We also have the universal traverse marketer. All these are useful, and I will end here and then pick your questions, and then I can continue if possible. So thank you.
Thank you. Thank you very much, Doc, for this brilliant presentation. We are much grateful. We know Doc is hard pressed with time, and so let's quickly have a few questions so that he can address that. If the questions are more, we can put them together, and maybe during one of the days, we may get Doc to join us to respond to them if he will be available. And so if you have any question, kindly put up your hand and we'll get you to speak. Or you can put your question in the chat box. So the floor is opened. Okay, sorry. I didn't know I was muted. Thank you very much, Doc. And as I mentioned earlier on, Doc is hard pressed with time, and so we'll take a few questions. If there are more, we'll put them together. Maybe in the course of the series, we may get Doc again to briefly respond to them. So the first one I have here is from Galaxy Tab A7. So kindly introduce yourself, the facility you work, and then you proceed with your question. Kindly be brief. Thank you very much. Galaxy Tab A7, kindly proceed.
Good afternoon, sir.
Yes, good afternoon. Kindly raise up your voice a bit.
Yeah, please, my name is Samuel Eboa. I'm from Wa East District, currently Bulinga Health Center in the Upper West region. And all student of UHAS, and I was actually taught by doctor. But my question is, doctor talked about the shape files. And my question has to do with assuming where I am working in my district. And then I have an old shape file, which was, let's say, created 10 years ago. And I want to do a map for my district, and then there was a facility created last 2 months. How do I create a shapefile and include that particular facility in my shapefile so that I can actually match my indicator with the new facility? Thank you.
Thank you very much. Doc, will you want to pick them one by one, or we take about 3 or 4 then you respond to? Hello, Dr. Sam, can you hear me?
Okay, so now, yeah, I can now, okay, so basically, you can always add, GIS data is always modifiable, you can always improve it. So whenever a new facility appears, you can always update your data and improve on it to contextualize it for your use. There are sites like GEDAM, GeoDay, DIVA have every data on most countries across the world. So even if you are mapping other countries and you want to know their health facilities and all those things, those informations are available. You can also leverage on and use. But you must always know the date that goes and the time, so the data available so that, yeah, I hope I've been able to address your question. Actually, Anas.
Yes, Doc.
Yeah, unfortunately, I think we've entered 3 o'clock and
yeah,
I'm supposed to move to another session. So maybe I can do for another 5 minutes and then I will drop off.
Okay. Thank you very much. Thank you for that gesture. So let's take the next one from Theophilus. Theophilus, kindly unmute and proceed.
Okay, thank you very much. Can you hear me?
Yes, you are loud.
Yes, I can hear you.
Okay, Doc, thanks for the nice presentation. My question is, bringing this context to where we work. Sorry, I'm in SDA Hospital, Kwadaso. Yeah, the GIS. But the main challenge that I had was on the facility levels, whether if these shape files can be developed and be used at the facility levels, because it was very, very difficult for us to use when it comes to the context of Ghana and sometimes maybe the regions. It really works, but at the facility levels, it becomes very, very difficult. And
Okay.
on the more serious note, let's look at
let me help you out. There are quite a number of things you can do, but all depends on your level of skills. I don't think probably what you want to do, you don't have the skills to do it. There are a lot of mapping you can do, track mapping, network mapping, a whole lot can be done. Even if you work at the facility level, you can network and map your disease, backtrack where your diseases are coming from and who is where and who is getting what. All those things can be done, but it also depends on the skills you have. It's not like take and use. You just see it and then
exactly. So, that is where I think I'm lacking.
So the skills you need to know that you must take advantage of online systems to be able to learn nowadays with what we call ChatGPT and the likes. Whatever you want to do, you just Google it. It will be able to tell you, and then you can just follow the guide, and then you'll be through. There are a lot of online platforms. You can go there and learn, and then use them. Okay.
Okay, Doc. I don't know. This is the last one. I don't know whether if Ghana Ghana Health Service use the GIS in terms of the mapping of the monkeypox, because normally we aren't seeing anything about the hotspot areas concerning the monkeypox. Yeah.
Don't worry, Ghana Health Service has a strong system for that, and we have a lot of people at the surveillance unit with that capability and capacity to do disease mapping. So I can assure you they are doing it. And also within the ladder of GHIMA, I know Patrick Papalabi and co. They are all involved in geospatial mapping. So that one I can assure you they are doing some kind of mapping. Maybe who to consume that information. If you are not the right person to just consume it, they might not share that with you. But maybe at the political level, where they need to mobilize the resources, they have to show it to them and all that. I believe they are doing that.
Oh, okay. Okay. Thank you, Doc. Thank you so much.
Yes.
Thank you very much.
Yeah. Thank you very much, Doc. Galazi, I've seen your hand again, but unfortunately we are unable to take questions because of time limitation. And so, Doc, we want to thank you very much for, going beyond the time. We are very sorry for holding you here. And we hope we'll have you again if there are any other issues or questions to respond to at the course of the CPD program, hopefully from tomorrow till Friday. I've looked through the chat box. We don't have any. Okay, someone is asking about how to set up ArcGIS. or to be installed in the machine. Doc, do you just want to respond to this one briefly? Okay, so I think Doc is gone. We may have him again in the course of our CPD program. So thank you very much. There are a few issues we have to discuss before we go. The first one is the registration link. Let's all endeavor to register to ensure that our names are captured, and we shall do daily registration. And we have the AI tool that is embedded to track every person in this particular meeting and how long you have stayed in this meeting. And that will help us in a long way to track people who have participated in this meeting and have gained something that will, make them acquire their CPD. So let's take note of that. We are also advised to stop writing our names in the chat box since we have a registration link. Once everybody is right, it becomes very difficult to fish out the questions and comments that people are posting or putting there. So let's also take note of that. A very important information that all of us need to take note has to do with the Allied Health Survey that is currently ongoing. If you have not seen the link yet, we'll be sharing the link again. It is very, very important for every health information officer to respond to this particular survey. It's a survey from the Allied Health Professions Council that try to measure the knowledge, practices, and challenges in health information management. And every HI's input is very important because this will go a long way in developing policies, most importantly when it comes to training and also regulating the work that we do. And so if we don't respond to that and the few responses that they have, they will use that to make decisions. And at the end of the day, it will come back and enhance all of us. So let's all endeavor to respond to that survey. It's a very short one. It doesn't take long time to respond to. And so let's all do that. On this particular note, before I go back to the General Secretary and the President, I want to call on the Treasurer, if she's available to respond to people who were asking questions concerning how non-members can do payment. How non-members can do payment. And so, Madam Eva, if you're on call now, can you respond to how non-members can do payment? Madam Eva, can you hear me? Okay, so I saw you. If you are having technical challenges, you reposition yourself. We'll come back to you. So on this note, let me go to the technical team. Mr. Senam, if you can hear me, are there any comments you want to make before we go to the Secretary and then the President will close us for the day?
No, very well. Thank you very much, organizer. Please, I want to ask, which name is the treasurer using?
Treasurer is using Eva F. Ban.
So I can unmute her so she can.
Yes, I can see her. She's here. I think she's having challenges in speaking.
Is that the name you want?
Mr. Sena, are you speaking?
Yeah, so she can now speak. She can unmute and speak. Thank you.
Okay. Okay, all right. Thank you very much. And so let me move to General Secretary. If there are any comments or announcements he wants to pass before we go to the President. General Secretary.
Yeah, hello, organizer. Before the General Secretary comes in, I've unmuted Miss Eva. So those who are not on payroll, those who are not on payroll, who are our members, those who are not on active payroll, who are our members who would also want to pay. Let's lay emphasis on that. And maybe those who are, not GHIMA members who are also on call. So let's take note of that. Thank you.
Yeah, thank you very much. So, Madam Treasurer, there were issues about how non-members can do payments. Maybe some members who are not also on payroll, how can they do payments? So kindly respond to this. Thank you. Treasurer, can you hear us?
Hello, can I be heard?
Yes, I can hear you now.
Yeah, I was trying. Okay, so I will post there.
We've lost your voice again. Okay, so once a treasurer is having challenges, treasurer, can you put whatever you want to say on the comment section? I know you wanted to say you post the payment details on the chat box, so kindly go ahead to do so. Mr. Senam, can you respond to this question? Is the registration link shared on the YouTube platform? If not, kindly share.
Yeah, so currently the registration form is only on Zoom. So I would quickly share it on the YouTube platform. So those who are watching on YouTube can also register. Thank you. So check your YouTube. Those who are watching on YouTube, they should check the comment section. We have the link there so they can also register. Thank you.
Thank you. Thank you very much. Mr. Mante, your hand is up. We'll give you the opportunity to speak. So kindly unmute.
Good
afternoon. Mr. Mante, you can talk. Yes.
Good afternoon.
Yes, good afternoon, boss.
I know the session has been recorded, but I want to know if you are going to get the recording, because previously, whenever we are told the recording will be sent to us, you don't get them. So I'm asking, when are we going to get the recorded session?
All right, Mr. Mante, thank you very much. I mean, this one is very simple. This section has been recorded, and I also want to let you understand that it is live on YouTube. So when you visit our YouTube channel, you can always play back. It's a live show, so you can always play back on the YouTube channel. But then, better still, we'll find a way of sharing all these files with you. But the easiest way now, we were live on YouTube. So you can always go back and have a playback at any point in time. So I urge all of you on call to go and subscribe to our YouTube channel, like the video, and you can always play back at any point in time. Thank you.
Thank you. Thank you very much. I have also posted the Allied Health Professions Council survey link on this chat box and also on our general page. So let us all make sure we respond to that. Thank you very much. So now I will turn to the secretary to give us his concluding comments and announcements if there are any.
Okay.
Mr.
So
Meuda.
thank you very much.
Thank you.
Thank you, Organizer Secretary. And Dr. Sam is not here. I want to appreciate what he has done today and the promise to be available for a subsequent assignment. For the payment, Madam Eva, who is treasurer, will be sharing the account to which we will pay the money. So we have 4 extra days to go. So look out for that. That will be shared. If not today, tomorrow, you have it done. You go through the process to make the payment. As to how much, I think we indicated 200 Ghana cedis for non-members of GHIMA. Non-members of GHIMA. So that is also stated. So let's comply with that. For today, we are grateful for all those who contributed to the success of the activities for today tomorrow we are expecting all of us to join. The time is important. We had to start joining before 2 o'clock. Before the 2 is the time we are starting. So let's join before 2 o'clock. Then we can have a fruitful session. So I'll end here and allow the president to conclude for us. Thank you very much.
Thank you. Thank you very much, General Secretary. On this note, I want to give opportunity again. Is there any other person who has a burning issue that they want to raise? Because when the president speaks, the opportunity closes for the day. Okay, so since I'm not seeing any hand up, I will call on Mr. Dalali, the president of GHIMA and the chair of NEC, to give us the closing remarks for the day. Boss, kindly unmute and proceed, sir. Honorable Delali, the floor is yours. Can you hear us, please?
Chairman, please, you are unmuted. You can speak now.
Okay. Who has embargoed me? When I was unmuted, said I have to respectfully contact my host. That is very good validatory procedure, not to allow the participants to just unmute anytime and be disturbing. Chariot to the host. Right, I just want to appreciate all and sundry for being part of this program. For me, as our brother in lead of GHIMA, it's just an opportunity or a privilege. And so without you, I don't know what the title chair. I appreciate your participation, all those who put effort together to you very much. I also want to assure all members that we are doing all we can to lift the image of this association and the profession itself. And so I want to take this opportunity to advise everybody, once you know you are health information officer, please get on board any activity, any program that is being organized by either the association or the regulatory authority, anything concerning health information, anything concerning GHIMA, please just try as much as possible and get on board. A link has been shared. It's for a reason. Please, it's not for anything, not for maybe for joy, for the usual activity that the link has been placed there. No, this one is very, very important. It registers the credibility of GHIMA, the profession, and anything concerning GHIMA and the association and the profession we practice. Allied Health is in the front to collect this information from members concerning training, education within and in the training institution. And I also want to add that even though Allied Health Professions Council is in the front, WHO is also part of it. So you can see the magnitude of this exercise. So please, when I checked online, we were about 400 plus, I think 416 thereabout on call. Please, let us go back, send the good news to others. even those who are not here, let us talk to them. We're about 3,000 getting to 4,000. Let us send the information to our people, get the link and respond to the questions. And then tomorrow, let's bring join. And we're thinking that it will be business as usual. When you don't join, you still get the opportunity to have the CPD point. No, let us send this information. Officers are in contact with the current Minister of Health, Life Health Professions Council.
Honorable, kindly reposition yourself. We are losing your voice.
And so we should get on board. We have received a lot of promises. We have received a lot of promises at the ministry, and God willing, we will very soon we will see changes coming into the system. We are aware of all that our members are going through with the limbs and other working conditions. Yes, we are still negotiating, we are still in talk with Health Service Workers Union, the regulatory authority. And so, brothers and sisters, I want to assure you that on the way to success. And so everybody should get on board. I want to thank you very much for the day. And I wish everybody the rest of the day. Thank you very much.
Okay. Thank you very much, Mr. President, and thank you everyone for joining today's meeting. Tomorrow is another day, exactly at 2 p.m. prompt. We'll be meeting again. We started this meeting in the name of God, and we are closing this meeting in the name of God. As we are closing, we are not leaving the presence of God. We continue to pray that He guide us, He protect us, all of us and our families, so that tomorrow we will get the strength to continue with our CPD program. Amen. And goodbye to everyone. Hoping to see you all tomorrow. Assalamu alaikum wa rahmatullah.